Phlebotomy Textbook, Chapter 1, Phlebotomy and Healthcare Delivery System. Please see the PowerPoint and eLearn for learning outcomes and key terms. We will start with the history of phlebotomy. The term comes from phleb, meaning vein, and otomy, meaning incision. Therefore, phlebotomy is defined as an incision into a vein. It is one of the oldest medical procedures. Originally, people used bloodletting as a medical procedure. It is actually thought that George Washington actually died from excessive bloodletting. Today, there are several diseases that benefit from having blood drawn: hemochromatosis and polycythemia vera. A person with hemochromatosis, an inherited disorder, benefits from periodic collections to prevent excess iron from being deposited in the tissues. Polycythemia vera is a blood disease that starts with overproduction of red blood cells and eventually becomes aplastic anemia, so overproduction followed by no production of red blood cells. There are different devices used for bloodletting. Today we use standard blood collection supplies, usually at the blood donor center. Leeches were used in the past for this procedure, but I read that leeches are sometimes used to help anticoagulate the blood in tissues that are damaged, such as large chunks of tissue needing reattachment. Today, we call it therapeutic phlebotomy. Some years back, the NIH actually obtained 15% of their blood supply for transfusion from patients with hemochromatosis. The role of the phlebotomist now is primarily the collection of blood for laboratory testing. The phlebotomy team is a specialized area of the clinical laboratory. They are key players in the laboratory, and good skills make them vital. There is a possibility of cross-training and being able to expand upon your training depending on the employer. The phlebotomist is the primary liaison between the patient and the lab. This slide covers the traditional duties and responsibilities of a phlebotomist. Correct identification of the patient prior to specimen collection is the most critical step. Collection of the appropriate amount of blood by venipuncture or dermal puncture for the specific tests that are ordered. Selection of the appropriate specimen containers for the specified test, and correct labeling of all specimens with the required information. Additional duties include appropriate transportation of specimens back to the laboratory in a timely manner and at the right temperature. You must have effective interactions with patients and hospital personnel. Other important duties include processing specimens for delivery to the appropriate laboratory departments, performance of computer operations, and record keeping pertaining to phlebotomy. Maintaining patient confidentiality according to HIPAA. Observation of all safety regulations, quality control checks, and preventive maintenance procedures, and attendance at continuing education programs. Important changes in the health care delivery system include changes to increase efficiency and cost effectiveness, patient-focused care, cross-training of personnel, and decentralization of phlebotomy services. Additional duties of the phlebotomist might include training other healthcare personnel to perform phlebotomy, monitoring the quality of specimens collected on the unit, evaluating protocols associated with specimen collection, performing and monitoring point-of-care testing, and performing electrocardiograms. Phlebotomist duties do not usually include performing measurement of patients' vital signs, collecting arterial blood samples, collecting specimens from venous access devices, or assisting with bone marrow collection. When you are a phlebotomist, you are in a service-oriented industry and you will be the face of the laboratory, so it is important that you are kind and pleasant with patients. This slide lists professional and personal characteristic traits that are important when you work as a phlebotomist. You should be dependable, cooperative, committed, compassionate, courteous, and respectful. You must also have integrity, be honest, and have competence, and be organized, responsible, and flexible. Confidentiality is key. You must not share protected health information. Violations of HIPAA are serious and can result in your termination. You should never discuss a patient's information with anyone who does not need to know about it. If someone is taking care of a patient and needs the information to treat the patient, this is okay. But if someone is just being nosy, then they don't need to know the information. This slide lists the guidelines that you should follow for your appearance. You should wear clean and unwrinkled clothing, appropriate footwear, conservative jewelry, and makeup. Do not wear perfume or perfumed lotions. Hair should be clean, neat, and pulled out of the way. Poor personal hygiene is not acceptable. Be sure you have short, clean nails, and you should not wear artificial nails, which promote the growth of fungus. You will need good verbal, listening, and nonverbal skills. You need to be kind, confident, and caring while projecting this to the patient. Verbal barriers may be caused by hearing impairment, emotional situations, patient education level, age, language barriers, medications, and health status. This slide lists methods to overcome different communications barriers, age, and education levels. Avoid medical jargon. You are collecting a blood specimen rather than performing a phlebotomy. Use age-appropriate phrases. If someone is hard of hearing, speak loudly and clearly. Look directly at the patient to facilitate lip reading. Communicate in writing if necessary. Non-English speaking. Locate a hospital-based interpreter. Use hand signals, show equipment, etc. Remain calm, smiling, and reassuring. If patient is emotional, speak calmly and slowly. Do not appear rushed or disinterested. If somebody is visually impaired, speak directly to the patient, explain procedure fully, provide instructions in large print or braille. You should make sure that you have good listening skills. Active listening means looking directly at the patient, allowing the patient time to express their feelings, allowing the patient to describe why he or she is concerned, giving the patient feedback through appropriate responses, and encouraging patient communications by asking questions. Much of communication is through nonverbal communications. Smiling, eye contact, and displaying confidence are positive body language. Shuffling, avoiding contact, and being distracted are negative body language. Positive body language facilitates communication. Project a professional image. Indicates openness, thoughtfulness, cooperation, and confidence. In the chart, you will see some examples of positive body language. Please review the chart and think about how you are with these practices next time you're speaking with someone that you don't know very well. Negative body language hinders effective communication. It's distracting, suggests boredom, defensiveness, suspicion, secretiveness, or frustration. Indicates nervousness, discomfort, uneasiness, anxiety, or fear. Please review the examples of nonverbal cues and think about whether these are presented to others when you are listening to them. People's zones of comfort include within 2 feet, which is intimate, 2 to 4 feet, that is personal, 4 to 12 feet, which is social, and greater than 12 feet, which is public. People's comfortableness with distance changes during the pandemic. People now want to be further away from each other. You will be in people's intimate to personal space when collecting blood, so make sure you don't make them feel uncomfortable. The cultural diversity of many facilities may be different. However, realize that patients may have customs, beliefs, religions, and values that you have not grown up with. Be kind as you can, but do not let patients behave in ways that make you uncomfortable, just as you should try not to make them feel uncomfortable. Some guidelines to follow is to always smile and use a friendly tone of voice. Be patient with an alert to patient reactions. Do not stereotype. Be mindful of personal space. Take time to explain procedures when a patient seems apprehensive, and always show respect to your patients. When answering the phone, you should identify the location you're at and your name. Be prompt and polite. Before you transfer a call, be sure you give the person the number just in case the transfer fails. Always provide accurate information or refer the caller to someone who would have the information they need. Make sure someone doesn't have a critical call before they're placing them on hold, and always speak clearly and read back information to ensure it is correct. Standards for education and certification are developed by agencies. The NAACLS certifies clinical laboratory science programs and phlebotomy courses to ensure that the information a person should learn is in the program. The Clinical Laboratory Technology 2-year associate degree at Sinclair is certified by NAACLS. The ASCP certifies many types of laboratory professionals, including medical laboratory technicians, medical laboratory scientists, such as myself, and phlebotomists. When you complete ALH 1113 and 1114, you are eligible to be certified by the ASCP. The NPA is another organization that certifies phlebotomists. When you complete the course, it is recommended that you take a certification exam. The certification in your field gives you a higher level qualification when job hunting. The tables will show various agencies below. There are different routes of becoming qualified for certification, and we have programs that combine classroom with didactic and clinical practice, such as this one where you learn using the PowerPoints, and you come to class, and then you perform on the mannequin arm, and then you draw real people, and then you move on to a different clinical setting. The outline of the entry-level phlebotomy competencies from the National Accrediting Agency for Clinical Laboratory Science. It says that you should have knowledge of the healthcare delivery system and medical terminology, knowledge of infection control and safety, knowledge of basic anatomy and physiology and anatomical terminology related to the laboratory and the pathology of blood systems. You should have an understanding of the importance of specimen collection and the integrity for patient care. You should have knowledge of collection equipment, tube additives, special precautions, and interfering substances associated with laboratory tests. Performance of standard operating procedures in the collection of specimens. You should have an understanding of requisitions, specimen transport, and specimen processing. You should have understanding of quality assurance and quality control in phlebotomy. And you should be able to use effective and appropriate communication skills. This slide lists phlebotomist certification programs that are available to you. Please take the time to look at the different programs. At the end of our course, we will have you sign up so that you're eligible to take the American Society for Clinical Pathologists Phlebotomy Certification exam. But again, you choose whether you wish to do that or not, but it's definitely recommended. Here are some additional certifying organizations. You can see their requirements, costs, and other information at their websites. Many people get confused with these terms. The phlebotomy program is a certificate program. You receive a certificate of completion. You are not certified when you complete the course. The certificate does make you eligible to take a certification exam. Different accrediting agencies may have different requirements, and tests can be adaptive, which means the questions you get next are based on the number of correct answers you've gotten previous. You can also become a member of a professional organization that advocates for members of your profession. You will have continuing education requirements to maintain certification. Ohio does not have a licensure requirement for phlebotomists, but other states may have requirements for licensure. So make sure if you're going to be working in another state or moving to another state, make sure you check to see what their requirements are before you go looking for a job there. A licensure is something that may be required by some states, but is not required in Ohio. To become licensed, there is usually educational or training requirements. You should complete continuing education and receive continuing education units that you will report to maintain your license or certification. Do not be late with completion of the continuing education, or you may lose your license or certification and have to take exams again, which you, of course, do not want to do. CLIA is a law which requires people who work in the clinical labs to have certain amounts of education. It also requires that a deemed agency inspect the laboratories to ensure compliance with the law. The government does not inspect, but allows civilian organizations such as the Joint Commission, CAP, or COLA to inspect laboratories for compliance with the law. CLSI sets up recommendations for labs that maintain compliance with the law and standards of care. NAACLS certifies training programs such as the Clinical Lab Technology Program at Sinclair. CLIA is regulated by the Centers for Medicare and Medicaid Services and the Food and Drug Administration. The law sets levels of competency for lab tests. The law requires periodic inspection, and an organization can choose which deemed organization they wish to inspect them. CAP is a major organization for inspecting laboratories. The Joint Commission will inspect hospitals as well as labs, but many labs still choose CAP. COLA is a laboratory accrediting agency like CAP, and the AABB only accredits transfusion services or donor centers. This chart shows you the difference for complexity of testing. A wave test is a test that are considered easy to perform by following the manufacturer's instruction and have little risk of error. No special training or education is required. For example, a urine pregnancy test that you can buy in the store. We have provider-performed microscopy procedures. So this is microscopic testing performed by a physician, mid-level practitioner, or dentist. So an example might be usually it's not a microscopic urinalysis, but it could be. But like if you go to the OB doctor, they can look and see if you have a yeast infection. That's a good example of one. Moderate complexity testing. This is tests that require documentation of training in test procedures, principles, instructions, calibration, periodic proficiency testing, and on-site inspections. So at this level, you must usually have an associate's degree in clinical lab science. So moderate complexity testing is something that might be mostly automated, like with an instrumentation such as complete blood count. And high complexity testing is tests that require sophisticated instrumentations or a high degree of interpretation. Proficiency testing and on-site inspections are required. So this example would be, well, urine culture or any kind of microbiological testing or blood banking, transfusion medicine. Those are all high complexity tests. CLIA provides standards for patient test management, quality assurance, quality control, proficiency testing, personnel qualifications, complaint investigations, and inspections. CLSI is a nonprofit that publishes recommendations by nationally recognized experts. Following these recommendations can improve the standards of care in your facility, but they're not required, they're recommendations. The Joint Commission accredits and certifies healthcare organizations. They set national patient safety goals to improve the accuracy of patient identification, improve the effectiveness of communication among caregivers, reduce the risk of healthcare-associated infections. They inspect organizations every 3 years and laboratories every 2 years. The College of American Pathologists, or CAP, is an organization of board-certified pathologists that provides laboratory accreditation, proficiency testing, and biennial inspections. COLA is more popular among physician office laboratories or independent laboratories for accreditation. NAACLS states the phlebotomy program should provide knowledge of the healthcare system and medical terminology, knowledge of infection control, knowledge of basic anatomy and physiology and anatomical terms related to the laboratory and the pathology of body systems, understanding of the importance of sample collection and integrity for patient care. This is continued from the last page. Knowledge of collection equipment, tube additives, special precautions, interfering substances associated with laboratory tests, performance of standard operating procedures and collection of samples, understanding of requisitions, sample transport, and sample processing. Again, continued, you have to have an understanding of quality assurance and quality control in phlebotomy, use of effective and appropriate communication skills. There are many companies that employ phlebotomists. Some employment settings include hospitals, physician office laboratories, health maintenance organizations, reference laboratories, urgent care centers, nursing homes, home health care agencies, blood donor centers, and even insurance companies that have you drive around and draw blood from patients or from people who aren't patients but who are trying to get some kind of life insurance. This slide shows you the different areas of the hospital and the description of what occurs in that area. Please take the time to review the slide if you don't understand what happens in the different areas of the laboratory. And this is a continuation of the chart that we saw on the last slide. In healthcare delivery systems, each department will have a specific purpose. Nurses have direct patient care, support services maintain the facilities and equipment, fiscal services perform budget control and billing, and professional services assist in diagnosis and treatment of disease. So nursing services, you might be working in someone who's a nurse, cardiac care units, emergency department, intensive care unit, nursing and operating rooms. So people who fall into this area could be registered nurses, who could be associate degree nurses or Bachelor of Science in Nursing. They both can be RNs. You can have, so level below that, someone who doesn't have an associate's degree, a licensed practical nurse, and below that, a certified nurse assistant. You could have a unit clerk or an OR technician. So in support services, we have food service, ground care, housekeeping, human resources, laundry, maintenance, purchasing, and security. Fiscal services include accounting, admitting, business office, credit and collection, data processing, and medical records. Professional services include radiology, such as X-ray, CAT scans, MRIs, radiation therapy, cancer treatment, nuclear medicine, which can do organ scans or laboratory tests, occupational therapy, and pharmacy. I feel like the laboratory ought to be on that slide. Maybe here. Here we are, still under professional services, but at the end, we have still physical therapy, respiratory therapy, cardiovascular testing, such as stress tests, the clinical laboratory, which of course does diagnostic testing, and there we are, phlebotomy. Other healthcare settings include physician office laboratories and group practices, health maintenance organizations, reference laboratories. So if it's a test that's not very common, so a laboratory that's in a hospital will send it to a reference laboratory where they have somebody who does maybe more of those for like multiple hospitals all over the country. Government and hospital sponsored clinics. So you have like the VA hospital or the military hospital, and you can have specialty clinics, wellness clinics, or alternative medicine clinics. Home health care or diagnostic related groups. And that's it for this lecture. Thank you for listening. That's the end of chapter 1.